Hello, my name's Joyce Gibb. Thanks so much for being with me today. And I have 4 emails or so I wanted to go over with you. They're on different topics, and these are the actual ones that people have sent that I answer. And so this might help somebody that you know that you would want to have them look this up. The first one is from a patient that says, "Hello, thank you for all you do." This is basically to Joe. "I love your wisdom of the Bible. I listen most every day. My question is, what sleep essentials should I start with? I've been taking generic Restoril for many years as a sleep aid and would like to quit. I know in the long run it does damage, but I have never found anything else that works. I've tried many pharmacy types in the past that made me sleepwalk. Blessing to you and your staff." So the one thing with any sleep aid, you have to, anybody that's elderly, you have just to really make sure that they're not too sedated and they try to get up in the middle of the night, say to go to the bathroom. You don't want them falling and breaking a hip. So, one of the things that I like to talk about is our sleep essentials. You can take 1 to 2 at night. For this person to substitute, I would substitute 1 night a week and do the rest with Restoril that they're using. And then maybe the next week, maybe take it 2 nights a week, just to kind of gradually wean off that over time, because, you can't have side effects and withdrawal from certain medications. But there's melatonin, there's 5-HTP, a small dose, and a little bit of GABA in that to help you sleep. So that's the first one. The second one comes from somebody named Chad. And it says, "You recommended a product for a general flush. What was the product? Also, recommended vitamins to protect against ACLS. What vitamins are those?" So the first thing to address the flush, we typically recommend vitamin C, ascorbate powder. And to do the flush, there's a little protocol for that. But basically, do 2 teaspoons in 2 to 3 ounces of water every 15 minutes. And that's basically for about 6 to 8 times. Most people, that's what they need for the flush. You get an internal rumbling, and that's like an internal enema comes out. So you do it's like a clean out for a colonoscopy. Vitamin C can be used for they were talking about, for ALS, or N-acetylcysteine, which is going to be going off the market. That raises glutathione, and it's just the FDA has taken that N-acetylcysteine or NAC off the market. So glutathione does the same thing. It's what N-acetylcysteine raises. So I would recommend that, and supporting vitamin D, omegas, which are good for the brain and for the neurovascular system with ACLS, and also magnesium. All right, so the next email, it says, "Hello, can the new women's daily multivitamin capsule be opened and added to food or drink? I have a hard time swallowing tablets, even it's a capsule." So yes, you can open it up. You can put it in applesauce or anything that you'd like to put it in. And it has a lot of really good ingredients in there. So, in the methylated forms of the bees. So you can open it up. I can't guarantee how good that's going to taste with all those minerals and vitamins in there, but it is another way to actually do that. All right, so the last email is from someone that says, "I'm 56-year-old female and have never taken supplements. I was diagnosed in 2007 with hypothyroidism, Hashimoto's disease. I've been taking levothyroxine 50 micrograms since 2007. Strength has never changed. I work at a computer 9+ hours a day." And I think the strength they were talking about was probably still good strength, hasn't changed. "The doctor says I'm probably in premenopause or menopause, and being 56, I would bet that it's menopause. I stopped having a period about a year ago. I just feel at this point I would like to be proactive with my health, as we all do. None of my doctors recommended anything. Menopause doesn't seem to be an issue now. Thank you." So just some basic supplements I recommend for almost everybody is vitamin D. There's vitamin D's in the nucleus of every cell, and it regulates about 1,000 genes in your body. B12, which helps with strength and your neurons to fire. Omegas, which help is fat for your brain. It's good fats for your brain, so that's good, and also decreases inflammation. And then actually adding salmon or flaxseed as another food source. the daily essentials, which has all the minerals and vitamins in it, and then a probiotic that you can cycle off and on, 1 month on, 1 month off. And we have our probiotic essentials, has 11 different strains in it. We have a spore probiotic, a really high dose probiotic that's 225 billion CFUs, and one that's 100 billion. And then we have a women's probiotic. So if you would like to talk with me about any of those supplements and how I can help you on your journey to good health, just give me a call. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.